this one will go over just that roll a little bit. I think it's fairly short, and then we'll kind of go into just the BLS video.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show the successful resuscitation of a patient in cardiac arrest requires a coordinated team effort. Effective teams have providers with well-defined roles, and they work together in a dynamic and timely fashion to prioritize and complete critical tasks. The team leader is responsible for coordinating these tasks and ensuring that clinical care is delivered according to American Heart Association guidelines. Delivering high-quality CPR while minimizing pauses optimizes outcomes after cardiac arrest. But because of competing priorities, it can be difficult for team leaders to continuously monitor and provide feedback on CPR quality. The CPR coach is a new role within the resuscitation team, and it's designed to address these difficulties and promote the delivery of high-quality CPR. The presence of a CPR coach allows the team leader to focus on other elements of cardiac arrest care. Whether you are a basic life support provider or an advanced life support provider, the role of CPR coach exists to help you and your team deliver high-quality CPR. The most effective way to implement the role of a CPR coach is with a real-time audio-visual feedback device. We'll discuss some of the functions of the CPR coach and how they use feedback devices. First, let's talk about the team layout when using a CPR coach. CPR coaches should stand across from the compressor, always in the compressor's direct line of sight. CPR coaches should also stand next to the CPR feedback display, which is often located on the defibrillator, so that they can effortlessly redirect the compressor's attention to the data provided by the feedback device. Now that the CPR coach is in place, they should verbalize the data from the feedback device, providing corrective and positive feedback, such as push harder or your rate is good.
Great job. You're right on target.
In addition to giving corrective feedback, CPR coaches should give mid-range targets so that providers can focus on a precise metric. An example of this would be coaching the compressor to target a rate of 110 compressions per minute, taking the average between the recommended range of 100 to 120 compressions per minute.
And now you're too fast. Target heart rate is 110.
The CPR coach should also coordinate the initiation of CPR and pauses in CPR. These actions can include initiating CPR, placing a CPR board if needed, analyzing the rhythm, switching compressors, defibrillating, or intubating the patient. The goal of the coach is to keep all pauses to 5 seconds or less when possible.
Switch.
Okay, Lathia, go ahead and
Hover.
start. Shock.
Clear. Shock. Resume.
Except for intubation. Intubation should be performed by skilled providers, ideally without stopping compressions.
Okay, through the cords.
But if it's necessary to pause for intubation, the pause must be for 10 seconds or less.
Still having trouble. Go ahead and pause CPR. Okay, there we go. Through the cords. Continue.
If intubation can't be accomplished in 10 seconds or less, the team should continue compressions with bag mask ventilation. Being an effective CPR coach takes practice and training. If you'd like to learn more about how you can incorporate the CPR coach role into your resuscitation team, please ask your instructor for more information.
So that was like where they showed that, you know, how she was telling them kind of hover when they did the pause for a second, not to totally walk away. That's, I think, a little bit harder sometimes if you're trying to reach over the gurney, you know, because if they're trying to deliver a shock or something. So if we're able to stand on the step stool and still kind of maintain that position a little bit. What else on that one? Just trying to keep track of pauses and stuff. And that's how, when they do that compression chest compression fraction is basically like saying, okay, so they'll take the total amount of the length of your code. So this is where the two timers come into effect. You're basically taking the total time that the code started, so the time the code initiated, you started chest compressions till the time it ends. That's one timer. And then basically the other timer is when the chest compressions are started. So you start the stopwatch, and then every time there's a pause, you pause the stopwatch. So your total time of doing chest compressions divided by the total time of the code divided by the total time you're doing compressions. And that's how you get that compression fraction, because you want it to have, I think they said, remember it's in this one, if it's in the BLS when they talk about, you want it to be ideally at least 80% or higher amount of the time that you're doing chest compressions. You don't want that to be lower, because then your pauses are too long, your interruptions are too long. So that's where that chest compression fraction comes in, and trying to keep track of it. Some of the monitors and the feedback devices and stuff now can kind of keep track of that a little bit more for you. And so I'm hoping that's where, as we start using these new monitors and looking at our code management statistics, kind of looking at those, we can see, where we are, in that, and hopefully try to improve that a little bit more if we need to. So that'll be one we can kind of watch and work on. But that CPR coach, it's even when you're in the middle of code, they're like, okay, the team leader's trying to do all that like they said, and then they're trying, okay, who's next? Who's going to rotate in and stuff. And so that role kind of gets traded over to somebody else, because whoever's running the monitor or even, doing medication, sometimes it's like, sometimes we're waiting several minutes before we can do anything else. And so that's where they've added that role kind of as your CPR coach to be that one that can watch over those and help do those. So, okay, we'll start on the BLS one. And like I said, when we get to this one, there'll be a part we'll kind of practice and just do 2 minutes. And then we'll stop and just kind of run through for the testing part of it. So.
Products. The foundation for resuscitation of cardiac arrest patients is high-quality basic life support. It's critical that you successfully perform these skills, because effective advanced cardiovascular life support depends on it. These skills help save lives. High-quality CPR maintains blood flow to vital organs, especially the heart and brain. The components of high-quality CPR include adequate compression depth. Remember to push hard, compressing at a depth of at least 2 inches. Make sure you position your body over the patient. Good body position, with the shoulders serving as the fulcrum over the chest, will help you use your own body weight to perform compressions. Consider a step stool if necessary to achieve this position. If the person is not on a firm, flat surface, consider inserting a short board beneath them. Adequate compression rate. It is important to push fast by compressing at a rate of 100 to 120 compressions per minute, allowing complete chest recoil between compressions, minimizing interruptions in compressions. Healthcare providers must minimize interruptions in chest compressions. This includes any pauses to deliver ventilations. When healthcare providers interrupt chest compressions, coronary perfusion pressure decreases dramatically and remains very low until compressions are resumed. It takes several compressions to build enough pressure to achieve an adequate coronary perfusion pressure necessary to get ROSC. And finally, avoiding excessive ventilation. The AHA requires the use of audio-visual feedback and prompt devices during a training practice and testing, and highly recommends use during real emergencies for real-time monitoring of CPR quality. The first skill we'll demonstrate is performing continuous chest compressions for 2 minutes.
So, if we want to get down on one of these, you can just pick one of these, and then we'll kind of talk about the feedback ones a little bit. Those of you that are on those, go ahead and we'll back this up just a little bit. We'll do 2 minutes, and then we'll talk about the.
Do you want this one? Do I want the baby? Hell yes, I want the baby.
Take the baby.
Hell yes, I do.
So that one, if you just hit the button on that one, you'll see the little lights will be right there on those. That one right there, you'll see them up on the shoulder. Once you start the 2 green lights, if it gets orange, it's too fast. Yep. You just want the 2 green lights to stay on, and then depth-wise, you'll hear that click. So go just a little. There, you're hearing that little click. If you don't go quite deep enough, you won't hear the click of that. Okay. And then we'll start. We'll just do 2 minutes. So, okay, ready? Everybody go for first aid, and then we'll switch.
So you just have to match Melissa's speed.
Yep, so you just gotta match the 2 that are.
Faster, Taylor. Slow down, Taylor.
Oh, you're a great coach.
Good job, Michelle.
I'll do my best.
And it was just like seeing that,
Synchronized swimming. Where's the timer in it? Oh, I
say, I think you're about done because it was on the timer on the thing. Okay. So, the one, at least from, this is from my experience with codes sometimes. A real person is somewhere in between that one and these. These are a lot harder than like a real one, and that one's a lot easier than a real one. So it's like somewhere in between on some of them. But the rate, just like it was showing in that video, sometimes, you know, the rate can vary quite a bit, but your goal is to be somewhere between that 100 and 120. At 120, you know, we're going a little bit too fast. We're not allowing the heart to fill enough to do as much good then. So there is kind of that range we need to try to stay in that rate. Yeah.
I think I did a little more.
That
one hurts.
The monitors, so when we get into code, it would be like that CPR coach too. There's the metronome on the monitor, so you can actually hit that if that helps to kind of keep that rate, you know, up. There is that built into the monitors. It's just a matter of in the moment of the code, somebody remembering to get on and set that so it goes off or whatever, so we can hear it. But I can't remember if there was.
That's fine.
In a real person, you might have the clicking also.
There's
Yeah,
also
you'll probably hear a lot of
The
clicking.
first few
The
compressions.
first,
There's one
the
of the little
first
boxes
few.
on the
There's two
chart.
little boxes, I think, right?
Oh, really? Yeah, there's another little one. Like I said, it's just a matter of hardly remembering to grab it to set it, but can't remember what else was on that.
Oh, I was just trying to see how hard I had to push her.
Yeah.
Skills. We'll now illustrate 2
Shandy always
healthcare
rubs her
providers assessing and
hand raw
performing
when we do
high-quality
this.
BLS,
Mannequins.
including the use of an
Oh, no,
AED.
she's aggressive.
So this one just goes through basically and kind of shows
It's a
you
blister
how
right
that
there.
handoff on the AED. So we'll kind of watch this one and then we'll stop it to practice.
The scene is safe. Are you okay? Are you okay? We need more help. Call for backup and bring the defib. No pulse. He's not breathing.
You say he's talking to himself.
He's not responding.
He must have run back to the station to get the AED.
Attach pads to patient's bare chest. Plug in pads connector.
You can try to attach the pads while
Analyzing
they're
heart
still
rhythm.
doing CPR. if
Do
you
not
can.
touch the patient. Shock needed.
Use the
Charging.
AED as soon as it gets there. Don't wait to complete your cycle.
Stay clear of patient.
Clear.
Deliver shock now. Shock delivered.
In summary, perform high-quality CPR by compressing at a depth of at least 2 inches and at a rate of 100 to 120 per minute, allowing complete chest recoil, minimizing interruptions in compressions, and avoiding excessive ventilation. Additional measures, such as switching compressors every 2 minutes or earlier if fatigued, and using an audio-visual feedback device to improve CPR quality in real time will help give patients the best chance for survival.
Okay.
I'm feeling a bit fatigued. I've never
So-
done chest compressions, I'm not tall enough, I'm sure, but.
Let's try this one.
Oh, on a baby, oh, on a couple babies.
Yeah, we've got stacking ones.
Yeah, now we have stacking
You're gonna
stools, I
just have
still
to
don't know if
in
that's
line
gonna be
carry
tall
your
enough.
own.
I'm gonna go grab one more.
Yeah,
do that.
you get right up there, boo.
Big old people, you have to get right in there with them.
Oh, I've only done them a couple times on babies. Usually we have other jobs besides compression.
Yeah, usually our jobs are other things, your IOs and,
Coach.
now you get to be a coach.
I'll be a
Okay,
coach.
so let's just go through a round with, the two. Let me grab one more AED and we'll use that baby one too, just cause it'll show you the feedback.
Do you have an elk ivory? Do I have a what? Is that an elk
No.
ivory?
You tricked me. It looks like it from afar.
I have one, but it doesn't matter.
So one of you can go ahead and start and just kind of pair up, and then the other ones that are waiting, we'll have you be the ones lining up kind of behind. So when they switch, you guys can switch out and line up behind
Someone's giving
somebody
breath.
else. So I don't know which one will work better. You can just use this one
Here.
and then, oh yeah, we'll trade
Should
you
we
out
get
for
that
little
mask,
one.
that little mask?
Wait a
You
baby.
can have that.
You can have that.
Okay.
Are you okay? Are you okay, Annie?
Yep, and you okay? That's a good song.
It actually goes up.
Crap, Annie's not okay. Annie's not okay?
Okay.
She not responding, guys.
What are we gonna do about it?
Yep. So remember,
Okay, she wouldn't wanna live
Yeah.
like that anyway.
as soon as you tap the patient, tap the patient, are you okay? And they're not responding to you, that's when you wanna call for help. Don't wait and check the pulse and scan, and then call. I mean, it's like just seconds. Call for help. Most of us are gonna be screaming down the hall. So,
We're gonna be running a mile and then coming back.
yeah,
to eat.
okay, so whoever wants to go first, go ahead and start, and then
Oh,
we'll
right.
do like about a 2-minute cycle, and then the person with the AED can come in and
Okay.
switch that
I'll
out.
do this.
We do help and then start chest compression?
Yeah, so go ahead and go through.
I'm running to get the AED.
Okay.
Yeah.
And you're running to get the AED. Do I have a person for airway or is it just me?
Just you for right now.
Okay.
So you're kinda start,
Alright, okay,
Your
you're
other
gonna get
personal.
some help.
yep,
It's just me, alright, and this is an adult, right?
yeah,
Okay.
we'll kinda use it like that, but.
'Kay.
But do your thing, so you come upon the you come upon the patient in the hall, it's like tap, okay?
Hello, go get
No.
some help and grab the monitor.
Are we all supposed to do this?
Yeah, go ahead and do it. Yep, you guys can do the same.
Okay.
Remember to check your pulse, and scan for breathing.
Oh, there's no pulse and he's not breathing.
Okay, good job.
I was trying to get
Your
that.
2 minutes has started.
To do breathing too, right?
We got 30 to 2. Okay, there you go. It's just when you stop, it just goes red to show that you're not.
It doesn't monitor your breaths, just your
No.
CPR, so
Yeah.
it's just like stop.
Yep, so you can go ahead and whenever you get there, you're gonna kinda hand it to her. You're basically handing it to her and
swap out.
saying you're swapping out. Melissa, you can do the same.
I'm here now.
So then Taylor can swap, there you go.
You put the AED on and I'll do compressions for you.
Well, we're gonna have to. Alright.
Connect electrode.
That one, Alex, if you wanna grab that remote out of the back right there, it'll.
Connect electrode.
There one.
So is that just a training remote?
Connect electrode.
Yeah, like. Oh, maybe it's not in all the way.
It's not in all the way, like it's, yeah, you gotta shove that in really good. There you go.
Connect.
Oh, there it is.